Hello and welcome back to Brunch with Bacon. I'm your host, Dr. Bacon, and today we're going to talk about a phone call I had this morning from a mid-20s female. Called that she's having some low back issues. She was referred to us by somebody who we've been seeing for about 8 years now, who comes in, does nutrition, optimal performance, really coming for the right ideas. So it's a strong referral. She called in, said she's been having some problems with her low back. I asked her, okay, great, what have you done? And she said, well, I went to a friend of mine it was a physical therapist, and she kind of did some evaluations, some tests, and said, I think I've got some musculoskeletal stuff going on, and maybe a tight muscle here, my IT bands or whatever the diagnosis was that she gave her, but wanted to see if I could help. And so the first thing I said to her was like, well, did this physical therapist ask her about any kind of digestive issues? And she goes, well, no, she hasn't. I said, well, and she kind of paused for a second. I said, well, okay, so tell me about your digestive issues. And she goes, oh, yeah, I do have really bad digestive issues. Actually, I'm constipated. I feel bloating. I have reflux. So all these things are going on, and yet nobody even talked to her about it. Well, that's kind of the root cause of what's happening. Because what I look at it, the way I was taught is, if there's inflammation happening in the digestive system, how close is that digestive system to our low back? So a lot of times you can see that some of that inflammation can transition into a visceral somatic issue where there's going to be more of the visceral problems in somatic into the muscle. And why we're going over this is to give you an opportunity, instead of just going and using your 10 visits or 20 visits or however many visits you get with your insurance, really starting to see maybe there's something else going on. Because even after time, that pain may go away. However, would she still have her digestive issues? And is that pretty important to take care of? So I want you to start thinking, this is why we're doing this Brunch with Bacon today. It was kind of a neat conversation this morning because she was kind of, baffled a little bit. But it's neat because now I want you to start thinking outside of the box, and maybe is there something else going on that you can be working on, or asking another question a little bit deeper to your primary care provider or who else you go to, whoever you're going to, for any back or hip or problems. And this gives you an opportunity to kind of dive a little bit deeper. This is what we do, and hopefully this Brunch with Bacon helped you out a little bit. And if it has, please like it and then share it or forward it to your friends so that they're now asking deeper questions. Remember, we're trying to build a community of people asking the right questions and getting healthier along the way. So once again, we'll keep putting these out there. Hopefully we'll see you again soon, and we'll talk to you then later. Thanks, and have a great day.